Question 1. A nurse is caring for a client with a new prescription for warfarin. Which laboratory value is most important for the nurse to monitor to determine the effectiveness of the medication? A. Complete blood count, CBC. B. Prothrombin time, PT/international normalized ratio, INR. C. Basic metabolic panel, BMP. D. Activated partial thromboplastin time, APTT. Answer: B. Prothrombin time, PT/international normalized ratio, INR. This question tests knowledge of pharmacokinetics, specifically monitoring parameters for anticoagulants. The key medication here is warfarin, a commonly prescribed oral anticoagulant. Warfarin's therapeutic effect is primarily monitored using the prothrombin time, PT, and its standardized measure, the International Normalized Ratio, INR, as these tests evaluate the extrinsic clotting pathway affected by the drug. An appropriate INR range, typically 2.0 to 3.0 for most conditions, indicates effective anticoagulation without excessive bleeding risk. For example, a client on warfarin should have their INR checked regularly to ensure it falls within the target range to prevent blood clots. Always remember that for warfarin, PT/INR is your go-to lab value for effectiveness. Question 2. A client is admitted with symptoms of left-sided heart failure. Which assessment finding would the nurse anticipate? A. Peripheral edema. B. Jugular venous distension. C. Crackles in the lungs. D. Hepatosplenomegaly. Answer: C. Crackles in the lungs. This question assesses understanding of the classic signs and symptoms of heart failure, specifically differentiating between left-sided and right-sided manifestations. Left-sided heart failure impairs the heart's ability to pump blood efficiently to the body, leading to a backup of blood into the lungs. The keyword left-sided directly points to pulmonary symptoms, and crackles are a hallmark sign of fluid accumulation in the lung alveoli, pulmonary edema, due to this backup. For instance, a client might report shortness of breath, especially when lying flat, indicating fluid in the lungs. Remember, L4 left-sided heart failure often means L4 lung symptoms like crackles. Question 3. A nurse is preparing to administer medications through a nasogastric, NG, tube. What is the most appropriate initial nursing action? A. Crush all medications to a fine powder. B. Mix all medications together before administration. C. Aspirate gastric contents to check for residual volume. D. Flush the NG tube with 5 milliliters of sterile water. Answer: C. Aspirate gastric contents to check for residual volume. This question focuses on safe medication administration via an NG tube, a common nursing procedure. The most appropriate initial step is to check for residual volume by aspirating gastric contents before administering medications. This action helps ensure proper tube placement, assess gastric emptying, and prevent medication accumulation that could lead to nausea or vomiting. For example, if a large residual volume is present, the nurse might need to hold the medication and notify the provider. Always prioritize patient safety by checking for residual volume first to confirm the stomach can accept the medication. Question 4. A client in the emergency department reports crushing chest pain radiating to the left arm and jaw. What is the nurse's priority action? A. Administer aspirin 325 milligrams orally. B. Obtain a 12-lead electrocardiogram, ECG. C. Administer sublingual nitroglycerin. D. Prepare the client for immediate cardiac catheterization. Answer: B. Obtain a 12-lead electrocardiogram, ECG. This question evaluates the nurse's ability to prioritize interventions for a client presenting with symptoms highly suggestive of a myocardial infarction, heart attack. While several actions are important, obtaining a 12-lead ECG is the priority because it provides crucial diagnostic information rapidly, allowing for differentiation between types of acute coronary syndromes and guiding immediate treatment decisions. For instance, an ECG showing ST elevation would prompt immediate activation of a cardiac catheterization lab. In acute chest pain, always think time is muscle, and an ECG is the fastest way to confirm cardiac involvement. Question 5. A nurse is providing discharge teaching to a client with a new colostomy. Which instruction is most important for the nurse to include? A. Change the ostomy bag every 24 hours. B. Avoid eating gas-producing foods. C. Report any skin irritation around the stoma. D. Restrict fluid intake to prevent diarrhea. Answer: C. Report any skin irritation around the stoma. This question assesses critical discharge teaching for clients with a new colostomy, focusing on common complications and client self-care. The most important instruction is to report any skin irritation around the stoma because peristomal skin breakdown is a frequent and significant complication that can lead to pain, infection, and difficulty with pouch adherence. For example, persistent redness, itching, or rash indicates a need for intervention to prevent further skin damage. Protecting the skin around the stoma is vital for comfort and preventing complications, so teach clients to monitor for and report any changes promptly. Question 6. A client with type 1 diabetes mellitus asks the nurse, "When should I take my regular insulin?" The nurse should instruct the client to take it. A. After meals, to correct elevated blood glucose. B. Once daily, in the morning, regardless of food intake. C. 30 to 60 minutes before meals. D. Only when blood glucose levels are above 200 milligrams per deciliter. Answer: C. 30 to 60 minutes before meals. This question tests understanding of insulin administration, specifically for regular insulin, which is a short-acting insulin. Regular insulin has an onset of action typically within 30 to 60 minutes, meaning it needs to be administered before meals to coincide with the post-meal rise in blood glucose. Administering it at the correct time helps to prevent postprandial hyperglycemia. For example, if a client plans to eat at 12 p.m., they should take their regular insulin between 11 a.m. and 11:30 a.m. Remember to always time short-acting insulin with anticipated food intake to manage blood glucose effectively. Question 7. A nurse is caring for a client with a new tracheostomy. Which nursing action is essential to prevent complications? A. Changing the tracheostomy ties every 8 hours. B. Maintaining a patent airway by suctioning as needed. C. Administering humidified oxygen via face mask. D. Inflating the cuff to maximum pressure. Answer: B. Maintaining a patent airway by suctioning as needed. This question focuses on essential nursing care for a client with a new tracheostomy, prioritizing safety and airway management. The primary goal for a client with a tracheostomy is maintaining a patent, or open, airway. Suctioning as needed prevents mucus plugs and secretions from obstructing the airway, which is a potentially life-threatening complication. For example, if a client exhibits signs of respiratory distress like noisy breathing or decreased oxygen saturation, prompt suctioning is indicated. Always remember that for a tracheostomy, ensuring a clear and open airway is your top priority. Question 8. A nurse is educating a pregnant client about proper nutrition. Which nutrient is crucial for preventing neural tube defects in the fetus? A. Iron. B. Calcium. C. Folic acid. D. Vitamin D. Answer: C. Folic acid. This question assesses knowledge of prenatal nutrition and its impact on fetal development. Folic acid, a B vitamin, is critically important during the preconception period and early pregnancy to prevent neural tube defects, NTDs, like spina bifida and anencephaly. Adequate intake of folic acid helps ensure the proper development of the fetal brain and spinal cord. For example, women of childbearing age, even before conception, are encouraged to take a folic acid supplement daily. Emphasize to expectant mothers that consuming enough folic acid is a key step in ensuring a healthy start for their baby. Question 9. A nurse is assessing a client who just received a dose of naloxone. Which assessment finding indicates the medication is having its desired effect? A. Decreased respiratory rate. B. Increased level of consciousness. C. Pinpoint pupils. D. Increased pain level. Answer: B. Increased level of consciousness. This question evaluates understanding of the therapeutic effects of naloxone, an opioid antagonist. Naloxone is administered to reverse the effects of opioid overdose, including central nervous system and respiratory depression. An increased level of consciousness, along with an improved respiratory rate, indicates that naloxone is effectively reversing the opioid's depressant effects on the brain. For example, a client who was unresponsive and had shallow breathing may become alert and breathe normally after receiving naloxone. The primary goal of naloxone is to reverse the life-threatening central nervous system depression caused by opioids, so look for improved alertness and breathing. Question 10. A nurse is caring for a client with a new arteriovenous AV fistula for hemodialysis. Which action should the nurse include in the client's plan of care? A. Auscultate the fistula for a bruit and palpate for a thrill daily. B. Use the fistula site for blood pressure measurements. C. Apply a warm compress to the site immediately after dialysis. D. Administer intravenous fluids through the fistula. Answer: A. Auscultate the fistula for a bruit and palpate for a thrill daily. This question tests knowledge of essential care for an AV fistula, a crucial access point for hemodialysis. Auscultating for a bruit, a whooshing sound, and palpating for a thrill, a buzzing sensation, are vital daily assessments to confirm the patency and function of the AV fistula. Absence of these findings may indicate a clot or malfunction, requiring immediate intervention. For example, if a nurse does not hear a bruit or feel a thrill, they should notify the healthcare provider promptly. Remember, bruit and thrill are your best friends for assessing AV fistula patency. Question 11. A nurse is teaching a client about preventing urinary tract infections, UTIs. Which statement by the client indicates an understanding of the teaching? A. I should drink at least 8 glasses of water a day. B. I should wipe from back to front after urinating. C. I should take bubble baths regularly. D. I should hold my urine for as long as possible. Answer: A. I should drink at least 8 glasses of water a day. This question assesses client understanding of common strategies to prevent urinary tract infections, UTIs. Drinking adequate fluids, specifically at least 8 glasses of water daily, helps flush bacteria from the urinary system and is a key preventive measure. This promotes regular bladder emptying, which is crucial for preventing bacterial buildup. For example, increased fluid intake makes urination more frequent, effectively washing out potential pathogens. Always emphasize the importance of good hydration and frequent voiding to help clients prevent UTIs. Question 12. A nurse is planning care for a client who is NPO, nothing by mouth, and has a fever. Which intervention is the priority for this client? A. Administering a tepid sponge bath. B. Monitoring intake and output. C. Applying a cooling blanket. D. Administering antipyretic medication. Answer: B. Monitoring intake and output. This question assesses the nurse's ability to prioritize interventions for a client who is NPO and febrile, highlighting fluid balance as a critical concern. Fever increases metabolic rate and fluid loss through insensible perspiration, making the client prone to dehydration, especially when NPO. Monitoring intake and output, INO, is the priority intervention to assess fluid balance and guide appropriate rehydration strategies. For example, if output significantly exceeds limited intake, the client might require intravenous fluid administration. In NPO clients with fever, always prioritize assessing and maintaining adequate hydration to prevent complications. Question 13. A nurse is providing education to a group of new parents about sudden infant death syndrome, SIDS, prevention. Which recommendation should the nurse include? A. Place the infant on their stomach to sleep. B. Use soft bedding and bumper pads in the crib. C. Place the infant on their back to sleep. D. Allow the infant to sleep in the parent's bed. Answer: C. Place the infant on their back to sleep. This question tests knowledge of evidence-based practices for SIDS prevention, a critical safety topic for infant care. The Back to Sleep campaign, now safe to sleep, has significantly reduced SIDS rates by advocating that infants be placed on their back for every sleep, whether napping or at night. This position helps prevent airway obstruction and overheating. For example, always ensure the baby's sleep environment is flat and firm, free of loose bedding, and in their own separate sleep space. Remember, back to sleep is the simplest yet most effective message for SIDS prevention. Question 14. A nurse is assessing a client with a deep vein thrombosis, DVT. Which assessment finding is most concerning and requires immediate intervention? A. Calf pain with dorsiflexion of the foot. B. Swelling and redness of the affected leg. C. Shortness of breath and chest pain. D. Positive D-dimer blood test result. Answer: C. Shortness of breath and chest pain. This question evaluates the nurse's ability to identify and prioritize signs of complications in a client with a DVT. While calf pain, swelling, and redness are expected DVT signs, shortness of breath and chest pain indicate a potential pulmonary embolism, PE, a life-threatening complication where a clot from the DVT travels to the lungs. A PE requires immediate medical attention and is the most concerning finding. For example, if a client suddenly develops dyspnea and pleuritic chest pain, the nurse must immediately notify the provider and prepare for emergency interventions. Always consider PE as the most dangerous complication of DVT. Question 15. A nurse is administering a subcutaneous injection. Which action is appropriate? A. Inject the medication at a 90-degree angle. B. Massage the injection site after administration. C. Pinch the skin and inject at a 45 to 90-degree angle. D. Aspirate for blood return before injecting the medication. Answer: C. Pinch the skin and inject at a 45 to 90-degree angle. This question assesses the correct technique for administering a subcutaneous injection, a fundamental nursing skill. For subcutaneous injections, the nurse should pinch the skin to elevate the adipose tissue and insert the needle at a 45 to 90-degree angle, depending on the client's body fat and needle length. This technique ensures the medication is deposited into the subcutaneous tissue layer. For example, a nurse administering insulin would use this method in the abdomen, thigh, or upper arm. Remember to pinch the skin and choose the appropriate angle to ensure accurate medication delivery into the subcutaneous layer. Question 16. A client with chronic kidney disease is advised to follow a low-sodium, low-potassium diet. Which food choice indicates a need for further teaching? A. Fresh apples. B. Canned soup. C. Unsalted rice. D. Cooked green beans. Answer: B. Canned soup. This question tests dietary teaching for a client with chronic kidney disease, specifically concerning sodium and potassium restrictions. Canned soups are typically very high in sodium, and often in potassium-rich ingredients, making them an inappropriate choice for a client on a low-sodium, low-potassium diet. High sodium intake can worsen fluid retention and hypertension, while high potassium can lead to dangerous cardiac arrhythmias in kidney disease. For example, a client opting for canned soup instead of homemade, low-sodium broth-based soup shows a misunderstanding of dietary restrictions. Always remind clients that processed and convenience foods are often hidden sources of high sodium and potassium. Question 17. A nurse is caring for a client with a new peripherally inserted central catheter, PICC. Which assessment finding requires immediate nursing intervention? A. Client reports mild discomfort at the insertion site. B. The dressing is slightly damp at the edge. C. Swelling and redness above the insertion site. D. Blood return is present when flushing the line. Answer: C. Swelling and redness above the insertion site. This question assesses the nurse's ability to identify potential complications associated with a PICC line, a common intravenous access device. Swelling and redness above the insertion site are critical signs of a possible infection or phlebitis, inflammation of the vein, which require immediate investigation and intervention to prevent serious complications like sepsis. While mild discomfort is possible and a slightly damp dressing might warrant a change, signs of inflammation indicate a more serious issue. For example, if these signs are present, the nurse should assess for fever, pain, and potentially culture the site. Always prioritize assessing and intervening for signs of infection or inflammation around central lines. Question 18. A nurse is teaching a client about self-administration of nitroglycerin for angina. Which statement by the client indicates effective teaching? A. I should chew the tablet for faster absorption. B. I can take up to 4 tablets every 5 minutes if pain persists. C. I should call 911 if pain is not relieved after 1 tablet. D. I should store the tablets in a clear plastic container. Answer: C. I should call 911 if pain is not relieved after 1 tablet. This question tests understanding of appropriate self-administration and emergency protocols for nitroglycerin in managing angina. The client should take 1 nitroglycerin tablet, wait 5 minutes, and if pain is not relieved, call 911 and then may take a second tablet. Taking up to 3 doses, 5 minutes apart, is the general rule, but calling emergency services after the first unrelieved dose is crucial to prevent further cardiac damage. For example, if a client experiences persistent chest pain after the initial dose, it could indicate a more serious cardiac event. Always prioritize seeking emergency medical help if nitroglycerin does not promptly relieve angina. Question 19. A nurse is caring for a client with delirium. Which nursing intervention is most appropriate for promoting the client's safety? A. Keeping the client in a dimly lit, quiet room. B. Applying wrist restraints to prevent wandering. C. Assigning the client to a private room far from the nursing station. D. Maintaining a consistent, well-lit environment. Answer: D. Maintaining a consistent, well-lit environment. This question focuses on appropriate nursing interventions for a client experiencing delirium, emphasizing safety and reducing confusion. Delirium is characterized by acute confusion and fluctuating consciousness, often worsened by sensory deprivation or overload. Maintaining a consistent, well-lit, and familiar environment helps reduce disorientation and agitation, thereby promoting client safety. For example, having a clock and calendar visible can help orient the client to time and day. Providing a structured and predictable environment is key to minimizing agitation and maximizing safety for clients with delirium. Question 20. A nurse is caring for a client who is actively bleeding from a large laceration. What is the nurse's priority action? A. Apply direct pressure to the wound. B. Elevate the injured extremity above the heart. C. Obtain a full set of vital signs. D. Prepare for immediate blood transfusion. Answer: A. Apply direct pressure to the wound. This question assesses the nurse's immediate priority in managing active external bleeding, a critical emergency situation. Applying direct pressure to the wound is the most immediate and effective first-line intervention to control external bleeding and prevent further blood loss. While other actions are important, stopping the bleeding is paramount for preserving life. For example, using a gloved hand with a clean dressing to press firmly on the laceration can significantly reduce blood flow. Always remember that direct pressure is your first and most crucial step in managing active external hemorrhage. Question 21. A nurse is teaching a parent about managing a child's fever at home. Which instruction should the nurse include? A. Administer aspirin every 4 hours. B. Bundle the child in blankets to promote sweating. C. Encourage liberal fluid intake. D. Give ibuprofen to an infant under 6 months old. Answer: C. Encourage liberal fluid intake. This question assesses safe and effective home management of fever in children. Encouraging liberal fluid intake is crucial for a child with a fever because fever increases fluid loss through perspiration, raising the risk of dehydration. Adequate hydration helps maintain circulating blood volume and supports the body's natural cooling mechanisms. For example, offer water, diluted juice, or popsicles frequently. Always prioritize hydration to prevent dehydration in a child with a fever. Question 22. A nurse is preparing to administer an intramuscular, IM, injection to an adult client. Which site is generally considered the safest for most IM injections? A. Deltoid. B. Dorsogluteal. C. Vastus lateralis. D. Ventrogluteal. Answer: D. Ventrogluteal. This question evaluates knowledge of safe intramuscular injection sites. The ventrogluteal site is generally considered the safest and preferred site for IM injections in adults and children over 7 months of age due to its distance from major nerves and blood vessels, and its ample muscle mass. It offers a large, thick muscle and a relatively pain-free injection experience. For example, when administering a viscous medication, the ventrogluteal site allows for a larger volume than the deltoid and avoids sciatic nerve injury risk associated with the dorsogluteal site. Always prioritize the ventrogluteal site for IM injections when appropriate to ensure client safety and comfort. Question 23. A nurse is providing discharge teaching for a client prescribed digoxin. Which instruction should the nurse include? A. Take an extra dose if you miss one. B. Hold the medication if your heart rate is above 100 beats per minute. C. Monitor your pulse rate daily before taking the medication. D. Increase your intake of potassium-rich foods. Answer: C. Monitor your pulse rate daily before taking the medication. This question assesses critical discharge teaching for clients taking digoxin, a cardiac glycoside with a narrow therapeutic range. Digoxin can cause bradycardia, so clients must be taught to monitor their apical pulse for a full minute before administering the medication and to hold the dose if the pulse is below 60 beats per minute, or as per provider's specific instructions. This prevents potential life-threatening bradycardia. For example, if a client's pulse is 55 bpm, they should hold their digoxin and report it to their healthcare provider. Always emphasize daily pulse monitoring as a key safety measure for clients taking digoxin. Question 24. A client reports severe abdominal pain, nausea, and vomiting. The nurse observes abdominal distension and absent bowel sounds. These findings are most suggestive of which condition? A. Gastritis. B. Appendicitis. C. Bowel obstruction. D. Ulcerative colitis. Answer: C. Bowel obstruction. This question assesses the nurse's ability to correlate assessment findings with a specific gastrointestinal condition. The combination of severe abdominal pain, nausea, vomiting, abdominal distension, and, critically, absent bowel sounds is highly indicative of a bowel obstruction. Absent bowel sounds suggest a complete lack of peristalsis beyond the obstruction point. For example, if a client has not passed gas or had a bowel movement in days, and presents with these symptoms, an obstruction is likely. Always consider bowel obstruction when abdominal pain is accompanied by distension and absent bowel sounds. Question 25. A nurse is caring for a client with a new order for a clear liquid diet. Which food item is appropriate for this client? A. Orange juice with pulp. B. Chicken broth. C. Vanilla ice cream. D. Plain yogurt. Answer: B. Chicken broth. This question tests knowledge of dietary progression, specifically identifying appropriate foods for a clear liquid diet. A clear liquid diet consists of liquids that are transparent and easily digestible, leaving minimal residue in the gastrointestinal tract. Chicken broth is a classic example of an appropriate clear liquid, providing some electrolytes and warmth. For example, other acceptable items include plain gelatin, clear fruit juices without pulp, and black coffee. Always remember that clear liquids are those you can see through, like broth, clear juice, or gelatin. Question 26. A nurse is administering pain medication to a client. The client states, "My pain is still a 7 out of 10. What is the most appropriate nursing action?" A. Tell the client to wait 30 minutes for the medication to take effect. B. Document the client's pain level and reassess in 2 hours. C. Reassess the client's pain level and consider alternative pain relief methods or request a new order. D. Explain that pain relief takes time and to try relaxation techniques. Answer: C. Reassess the client's pain level and consider alternative pain relief methods or request a new order. This question assesses the nurse's critical thinking and response to inadequate pain management. When a client's pain remains high after medication, the most appropriate action is to reassess thoroughly, identify contributing factors, and advocate for effective pain relief. This might involve exploring non-pharmacological methods, administering breakthrough pain medication if ordered, or contacting the healthcare provider for a different analgesic order. For example, the nurse might assess the pain's quality, location, and what has worked previously, then decide on the next steps. Always remember to advocate for your client's comfort by thoroughly reassessing pain and escalating care if necessary. Question 27. A nurse is preparing to administer insulin using a subcutaneous injection. Which site is most appropriate for consistent absorption? A. Deltoid. B. Vastus lateralis. C. Abdomen. D. Dorsogluteal. Answer: C. Abdomen. This question assesses the best practice for insulin administration, specifically regarding absorption consistency. The abdomen is the preferred site for insulin injections due to its consistent and predictable absorption rate, large surface area, and relative ease of self-administration for clients. Rotating sites within the same general area, like the abdomen, is also recommended to prevent lipodystrophy. For example, clients are often taught to inject insulin into different areas of the abdomen, at least 1 inch away from the navel. For consistent insulin absorption, the abdomen is generally the top choice. Question 28. A nurse is reinforcing teaching with a client about preventing falls at home. Which instruction is most important to include? A. Keep all rooms brightly lit throughout the day. B. Install grab bars in the bathroom. C. Wear loose-fitting clothing to avoid tripping. D. Limit fluid intake to reduce bathroom trips. Answer: B. Install grab bars in the bathroom. This question focuses on crucial home safety measures to prevent falls, especially for older adults or those with mobility issues. Installing grab bars in the bathroom provides crucial support and stability, particularly when getting on and off the toilet or in and out of the shower, where falls are very common due to wet surfaces and awkward movements. This is a direct physical modification that significantly enhances safety. For example, a client with weak leg muscles can use grab bars to lower and raise themselves without losing balance. Always prioritize environmental modifications like grab bars that directly address common fall risks in the home. Question 29. A nurse is assessing a client with a history of alcohol use disorder who is experiencing tremors, agitation, and hallucinations. These findings are consistent with which condition? A. Alcohol intoxication. B. Wernicke-Korsakoff syndrome. C. Delirium tremens. D. Alcoholic hepatitis. Answer: C. Delirium tremens. This question assesses the nurse's ability to identify the severe and potentially life-threatening symptoms of alcohol withdrawal. Delirium tremens, DTs, is a severe form of alcohol withdrawal characterized by profound confusion, agitation, disorientation, tremors, hallucinations, often visual, and autonomic hyperactivity. These symptoms typically appear 48 to 96 hours after the last drink and require immediate medical intervention. For example, a client might report seeing bugs crawling on the walls or feel insects on their skin. Always recognize that tremors, agitation, and hallucinations in alcohol withdrawal are red flags for delirium tremens, demanding urgent care. Question 30. A nurse is caring for a client receiving total parenteral nutrition, TPN. Which nursing action is essential to prevent complications? A. Administering TPN through a peripheral intravenous line. B. Rapidly infusing TPN to ensure adequate nutrition. C. Monitoring blood glucose levels regularly. D. Changing the TPN bag every 48 hours. Answer: C. Monitoring blood glucose levels regularly. This question assesses essential nursing care for clients receiving TPN, highlighting a common and serious complication. TPN solutions are typically high in dextrose, which can lead to hyperglycemia, high blood sugar, in clients, even those without a history of diabetes. Regular blood glucose monitoring is crucial to detect hyperglycemia early and allow for insulin administration or TPN rate adjustments. For example, a client might require insulin coverage to manage TPN-induced hyperglycemia. Always remember that TPN significantly impacts blood glucose, so consistent monitoring is paramount for client safety. Question 31. A client is receiving oxygen therapy via nasal cannula at 4 liters per minute. Which intervention should the nurse prioritize to ensure client safety and comfort? A. Restricting oral fluid intake. B. Applying petroleum jelly to the nares. C. Using a humidifier with the oxygen. D. Increasing the flow rate if oxygen saturation drops below 90%. Answer: C. Using a humidifier with the oxygen. This question addresses safe and comfortable oxygen administration via nasal cannula, specifically at higher flow rates. Oxygen delivered at 4 liters per minute or higher through a nasal cannula can cause dryness and irritation to the nasal mucosa. Using a humidifier helps to moisten the oxygen, preventing dryness, nosebleeds, and discomfort for the client. For example, a client might complain of a dry, irritated nose or throat if humidification is not used. Always remember to add humidification when oxygen flow rates are 4 liters per minute or higher to protect the client's mucous membranes. Question 32. A nurse is preparing to administer medications to a client. Which of the rights of medication administration should the nurse always verify first? A. Right time. B. Right client. C. Right dose. D. Right route. Answer: B. Right client. This question assesses foundational knowledge of medication safety, specifically the rights of medication administration. While all rights are crucial, verifying the right client is the absolute first step to prevent medication errors. Administering medication to the wrong person can have severe, life-threatening consequences. For example, the nurse should always check the client's name and date of birth against the medication administration record. Prioritizing the right client ensures that all subsequent steps of medication administration are performed for the correct individual. Question 33. A nurse is providing education to a client about managing nausea and vomiting during chemotherapy. Which dietary recommendation should the nurse include? A. Eat large meals 3 times a day. B. Consume hot, spicy foods. C. Eat small, frequent meals. D. Avoid all fluids with meals. Answer: C. Eat small, frequent meals. This question tests knowledge of dietary modifications for clients experiencing chemotherapy-induced nausea and vomiting, CINV, a common and debilitating side effect. Eating small, frequent meals throughout the day is generally better tolerated than large meals, as it prevents overfilling the stomach and helps maintain consistent nutrient intake without triggering nausea. For example, instead of 3 large meals, a client might eat 6 smaller meals or snacks. Encourage clients to eat bland, easily digestible foods in smaller portions to help manage nausea effectively. Question 34. A client post-appendectomy is refusing to ambulate, stating it hurts too much. What is the most appropriate nursing action? A. Document the refusal and allow the client to rest. B. Explain the importance of ambulation for recovery and offer pain medication. C. Restrain the client and ambulate with assistance. D. Inform the provider that the client is uncooperative. Answer: B. Explain the importance of ambulation for recovery and offer pain medication. This question assesses the nurse's ability to manage post-operative pain and encourage mobility, a critical aspect of recovery. Post-operative ambulation is vital for preventing complications like deep vein thrombosis and pneumonia. The most appropriate action is to address the client's pain first by offering analgesia, then explain the benefits of ambulation. For example, administering pain medication 30 minutes before planned ambulation can significantly improve the client's willingness and ability to move. Always ensure adequate pain control is in place before expecting clients to engage in painful but necessary activities. Question 35. A nurse is educating a client about the benefits of regular exercise. Which physiological change can be attributed to consistent aerobic exercise? A. Increased resting heart rate. B. Decreased high-density lipoprotein, HDL, cholesterol. C. Improved insulin sensitivity. D. Increased blood pressure. Answer: C. Improved insulin sensitivity. This question tests knowledge of the physiological benefits of regular aerobic exercise. Consistent aerobic exercise significantly improves insulin sensitivity, meaning the body's cells become more responsive to insulin, which helps regulate blood glucose levels more effectively. This is a crucial benefit for preventing and managing type 2 diabetes. For example, a person who exercises regularly may require less insulin to achieve the same glucose-lowering effect. Always remember that regular exercise is a powerful tool for improving overall metabolic health, particularly insulin sensitivity. Question 36. A nurse is caring for a client with a new prescription for metformin. Which laboratory value should the nurse monitor closely? A. Serum potassium. B. Liver function tests, LFTs. C. Renal function, creatinine and GFR. D. Complete blood count, CBC. Answer: C. Renal function, creatinine and GFR. This question assesses knowledge of medication monitoring, specifically for metformin, a common oral anti-diabetic drug. Metformin is primarily excreted by the kidneys, and impaired renal function can lead to drug accumulation and increase the risk of lactic acidosis, a serious complication. Therefore, monitoring renal function, particularly creatinine and glomerular filtration rate, GFR, is crucial before initiating and periodically during metformin therapy. For example, if a client's creatinine levels are elevated, the metformin dose might need to be reduced or the medication discontinued. Always prioritize renal function monitoring for clients taking metformin due to its excretion pathway. Question 37. A nurse is assessing a 4-year-old child admitted with dehydration. Which assessment finding is most indicative of severe dehydration? A. Decreased urine output. B. Tachycardia. C. Sunken fontanelles. D. Dry mucous membranes. Answer: C. Sunken fontanelles. This question evaluates the nurse's ability to identify critical signs of severe dehydration in a young child. While decreased urine output, tachycardia, and dry mucous membranes are all signs of dehydration, sunken fontanelles are a specific and late sign of severe dehydration in infants and young children, indicating significant fluid volume deficit. The fontanelles are soft spots on an infant's head where the skull bones have not yet fused. For example, a visibly depressed fontanelle in a dehydrated child signals an urgent need for fluid resuscitation. Always look for sunken fontanelles as a key indicator of severe dehydration in pediatric clients. Question 38. A nurse is providing education to a client about preventing pressure injuries. Which instruction is most important? A. Change positions every 4 hours. B. Massage bony prominences regularly. C. Inspect your skin daily for redness or open areas. D. Use a donut-shaped cushion when sitting. Answer: C. Inspect your skin daily for redness or open areas. This question assesses vital teaching for pressure injury prevention. Daily skin inspection, especially over bony prominences, is the most crucial instruction because it allows for early detection of skin changes like redness or blanching that indicate impending tissue damage. Early detection enables prompt intervention to prevent a full-blown pressure injury. For example, if a client notices a persistent red spot that doesn't disappear when pressed, they should alert their nurse or provider immediately. Early identification through daily skin checks is key to preventing pressure injuries from worsening. Question 39. A client is experiencing an allergic reaction to a medication, manifesting as urticaria and pruritus. What is the nurse's priority action? A. Administer diphenhydramine as ordered. B. Elevate the client's head of the bed. C. Discontinue the medication infusion immediately. D. Document the reaction in the client's chart. Answer: C. Discontinue the medication infusion immediately. This question assesses the nurse's immediate priority in managing an allergic reaction to a medication. The absolute first step is to stop the exposure to the allergen by discontinuing the medication infusion, even before administering an antidote or documenting. This prevents further progression of the reaction, which could become life-threatening. For example, if a client develops hives and itching during an antibiotic infusion, clamping the foretubing and stopping the drip is paramount. Always stop the offending agent immediately when an allergic reaction occurs to prevent further harm. Question 40. A nurse is caring for a client with a history of seizures. Which intervention is most appropriate during a tonic-clonic seizure? A. Insert a tongue blade into the client's mouth. B. Restrain the client's extremities to prevent injury. C. Place a pillow under the client's head and turn them to their side. D. Administer oxygen via non-rebreather mask. Answer: C. Place a pillow under the client's head and turn them to their side. This question tests essential seizure precautions and immediate nursing interventions during a tonic-clonic seizure. The primary goal is to protect the client from injury and maintain a patent airway. Placing a pillow under the head protects against head trauma, and turning the client to their side helps prevent aspiration of secretions or vomit. For example, if a client begins seizing, the nurse should immediately clear the area around them, loosen restrictive clothing, and position them safely. Never attempt to restrain or insert anything into the client's mouth during a seizure. Focus on safety and airway. Question 41. A nurse is providing care for a client with a newly inserted indwelling urinary catheter. Which action demonstrates appropriate catheter care? A. Cleaning the perineal area with antiseptic solution every 8 hours. B. Emptying the drainage bag when it is full. C. Ensuring the drainage bag is below the level of the bladder. D. Clamping the catheter tubing periodically to promote bladder tone. Answer: C. Ensuring the drainage bag is below the level of the bladder. This question assesses proper care for an indwelling urinary catheter, focusing on preventing urinary tract infections and promoting drainage. Keeping the drainage bag below the level of the bladder is crucial to prevent the backflow of urine into the bladder, which can introduce bacteria and lead to infection. This uses gravity to facilitate continuous drainage. For example, attaching the drainage bag to the bed frame, not the side rail, helps maintain proper positioning. Always remember to use gravity to your advantage by keeping the urinary drainage bag below the bladder. Question 42. A nurse is assessing a client with hyperkalemia. Which finding is most important for the nurse to report immediately to the healthcare provider? A. Muscle weakness. B. Nausea. C. Cardiac dysrhythmias. D. Diarrhea. Answer: C. Cardiac dysrhythmias. This question assesses the nurse's understanding of the most dangerous complication of hyperkalemia, high potassium levels. While muscle weakness, nausea, and diarrhea can occur with hyperkalemia, cardiac dysrhythmias are the most life-threatening complication because elevated potassium profoundly affects cardiac conduction, leading to potentially fatal arrhythmias like ventricular fibrillation. For example, the nurse might observe peak T waves on the ECG, a classic sign of hyperkalemia's effect on the heart. Always prioritize reporting any cardiac changes or dysrhythmias in a client with hyperkalemia as it indicates a life-threatening emergency. Question 43. A nurse is caring for a client who is confused and attempting to pull out their foreline. Which intervention should the nurse implement first? A. Apply wrist restraints. B. Reorient the client and distract them with an activity. C. Call the healthcare provider for a sedative order. D. Pad the bed rails and lower the bed. Answer: B. Reorient the client and distract them with an activity. This question assesses the nurse's approach to managing client confusion and agitation, prioritizing less restrictive interventions. The initial action for a confused client attempting to self-harm or disrupt therapy is to try non-pharmacological, least restrictive measures like reorientation and distraction. This approach aims to address the confusion and prevent the need for restraints, which can increase agitation and cause harm. For example, engaging the client in a simple conversation or offering a familiar object might redirect their attention. Always try de-escalation and reorientation first before resorting to restraints. Question 44. A nurse is educating a client about monitoring blood pressure at home. Which statement indicates a need for further teaching? A. I should take my blood pressure at the same time each day. B. I should avoid caffeine and exercise for 30 minutes before measuring. C. I can take my blood pressure multiple times right after each other if the first reading is high. D. I should sit quietly with my back supported and feet flat on the floor. Answer: C. I can take my blood pressure multiple times right after each other if the first reading is high. This question evaluates the client's understanding of accurate home blood pressure monitoring techniques. Taking multiple readings immediately after each other is incorrect because the initial reading can elevate the blood pressure, and subsequent readings without a short rest period, 1 to 2 minutes, may not be accurate. It's best to wait a few minutes between readings if repeated measurements are necessary. For example, if a client gets a high reading, they should relax for a few minutes before taking it again. Always instruct clients to allow a brief rest period between repeated blood pressure measurements for accuracy. Question 45. A nurse is preparing a client for discharge following a total knee arthroplasty. Which instruction is most important for the nurse to include in the discharge teaching? A. You will be able to bear full weight on your new knee immediately. B. Avoid using crutches or a walker once you feel strong enough. C. Continue physical therapy exercises regularly at home. D. Expect sharp, shooting pain for several months after surgery. Answer: C. Continue physical therapy exercises regularly at home. This question assesses essential discharge teaching for a client recovering from total knee arthroplasty, emphasizing the importance of rehabilitation. Continuing physical therapy exercises at home is paramount for regaining range of motion, strength, and function in the new knee joint and is critical for successful long-term outcomes. Consistency with these exercises directly impacts recovery and prevents stiffness. For example, a client must adhere to their prescribed exercises to improve their ability to walk and climb stairs. Always emphasize the critical role of consistent physical therapy in post-operative orthopedic recovery. Question 46. A nurse is performing a focused assessment on a client with a suspected urinary tract infection, UTI. Which question is most relevant to ask? A. Are you experiencing any changes in your vision? B. Have you noticed any pain or burning during urination? C. Do you have any difficulty swallowing? D. How often do you have a bowel movement? Answer: B. Have you noticed any pain or burning during urination? This question assesses the nurse's ability to conduct a focused assessment relevant to a specific condition, a urinary tract infection. Dysuria, pain or burning during urination, is a hallmark symptom of a UTI and is the most relevant question to ask to confirm the suspicion. This symptom indicates inflammation or infection of the urinary tract. For example, a client might also report increased frequency or urgency of urination, but dysuria is a key indicator. Always focus your assessment questions on the most common and indicative symptoms of the suspected condition. Question 47. A nurse is caring for a client with a new peripherally inserted central catheter, PICC, line. To prevent infection, which action is crucial during dressing changes? A. Wearing non-sterile gloves throughout the procedure. B. Cleaning the site with alcohol wipes in a circular motion. C. Using sterile technique and a chlorhexidine-based antiseptic. D. Changing the dressing once a week, regardless of condition. Answer: C. Using sterile technique and a chlorhexidine-based antiseptic. This question assesses knowledge of best practices for PICC line dressing changes, focusing on infection prevention. PICC lines are central venous catheters, and meticulous sterile technique, along with the use of a chlorhexidine-based antiseptic solution, is crucial during dressing changes to minimize the risk of catheter-related bloodstream infections. For example, the nurse should don a mask, sterile gloves, and maintain a sterile field throughout the procedure. Always prioritize strict sterile technique and appropriate antiseptic use when caring for central venous access devices to protect the client from infection. Question 48. A nurse is preparing to administer packed red blood cells, PRBCs, to a client. What is the most appropriate intravenous solution to prime the tubing with? A. Dextrose 5% in water, D5W. B. 0.9% sodium chloride, normal saline. C. Lactated Ringer's solution. D. Dextrose 5% in 0.45% sodium chloride. Answer: B. 0.9% sodium chloride, normal saline. This question tests critical knowledge regarding blood product administration and compatibility. 0.9% sodium chloride, normal saline, is the only intravenous solution that is compatible with packed red blood cells and should be used to prime the tubing. Other solutions, especially those containing dextrose or calcium, can cause hemolysis, destruction of the red blood cells, or initiate clotting. For example, if D5W were used, the red blood cells would rapidly swell and burst, rendering the transfusion ineffective and potentially harmful. Always remember that normal saline is the exclusive solution for priming and running with blood products. Question 49. A nurse is providing care to a client with dysphagia, difficulty swallowing. Which intervention is most appropriate to prevent aspiration? A. Offer thin liquids to encourage hydration. B. Position the client supine during meals. C. Encourage the client to eat quickly to minimize effort. D. Elevate the head of the bed to at least 45 to 90 degrees during meals. Answer: D. Elevate the head of the bed to at least 45 to 90 degrees during meals. This question assesses safe nursing care for clients with dysphagia, focusing on aspiration prevention. Elevating the head of the bed to at least 45 to 90 degrees, high Fowler's position, during meals and for 30 to 60 minutes afterward is crucial to facilitate gravity-assisted swallowing and minimize the risk of aspiration into the lungs. This position helps keep food and fluids moving down the esophagus. For example, if a client with a history of stroke has dysphagia, maintaining an upright position during all oral intake is vital. Always ensure clients with dysphagia are positioned upright to prevent aspiration. Question 50. A nurse is teaching a client about self-management of asthma using a peak flow meter. Which action indicates the client understands the teaching? A. Measures peak flow once a week, only when feeling unwell. B. Takes a quick, shallow breath before blowing into the meter. C. Uses the meter daily, standing, and blows out hard and fast. D. Records only the highest reading of 3 attempts. Answer: C. Uses the meter daily, standing, and blows out hard and fast. This question assesses proper technique for using a peak flow meter in asthma self-management. For accurate readings, the client should use the meter daily, typically in the morning, standing up, and take a deep breath before exhaling as hard and fast as possible into the device. This measures the maximum speed of exhalation. For example, the client should perform 3 attempts and record their highest reading to get an accurate daily baseline. Always teach clients to perform a forceful and fast exhalation into the peak flow meter to get the most accurate measurement of their lung function.